In 1945, a chemical process was added to the water supplies of Grand Rapids, Michigan, and Newburgh, New York, that has sparked controversy and conflict in the United States and throughout the world, and remains even today. This process is known as water fluoridation. Despite assurances by the government and the American Dental Association that fluoridation was safe, effective, and would reduce dental decay, many citizens opposed it. This concept of putting a controlled substance into drinking water to change a population's health through fluoridation has been rejected by voters in this country and throughout the world. Today, 95% of the world has not implemented or has rejected water fluoridation outright. In fact, about 60% of the 2,000 fluoridation initiatives held in the United States since 1950 have been defeated in the voting booth. Until today, most of you have heard only the advocate's perspective on fluoridation. This program will now tell the other side of the story. During the Industrial Revolution, dramatic new technologies improved the American way of life. But at the same time, water and air pollution increased. One of the chemicals causing environmental problems was fluoride, produced by the growing number of factories. This highly toxic compound damaged plant and animal life, defoliating vegetation, crippling the bones of farm animals and humans alike. At about that same time, in 1901, people living in Colorado were showing signs of a mysterious disease affecting their teeth, making them white-blotched, or in more severe cases, dark brown and pitted. This permanent staining was called dental mottling by local dentist Dr. F. McKay. In 1931, Dr. H. Trendley Dean from the National Institutes of Health discovered the cause of this disease to be a naturally occurring contaminant in the water, fluoride levels of less than 8 parts per million. He named this condition dental fluorosis. At the same time dental fluorosis affected the teeth of its victims, it also caused another disease, skeletal fluorosis. Observing that while many of the residents' teeth were brown and pitted, some who were less affected seemed to be resistant to dental decay. Dr. Dean remarked that perhaps a small amount of fluoride, about 1 part per million, should be left in the water in hopes of reducing dental decay. Fluoride, entering the body, passes through the mouth, down the throat, into the stomach, then deposits itself in the soft tissue and bones of the body, in particular, the long bones and the teeth. About half of the fluoride ingested is excreted through the kidneys, provided they are working properly. The remaining 50% accumulates in the body over a lifetime. Although never proven in a laboratory setting, the theory was that fluoride taken internally through water fluoridation would strengthen the bones in the teeth, making the enamel of the teeth more resistant to dental decay, especially in young children whose teeth had not yet erupted. It was claimed at the time that dental decay rates would be decreased through fluoridation by 40 to 60%. Today, medical researchers have downplayed the role of systemic or internal fluoride and claim the principal benefit comes when it is applied topically to the surface of the teeth, as in toothpaste, mouthwash, or sealants. The new thinking is that fluoride inhibits rather than destroys the bacteria responsible for tooth decay and aids remineralization of the tooth surface. One well-recognized modern study supports this thinking, finding that water fluoridation activists have tried to show that fluoride is the primary cause of a decline in cavities observed over the course of many years. But where the Center for Disease Control study illustrated here leaves off, the World Health Organization picks up. The World Health Organization has identified that cavities, or dental caries, have declined worldwide just as fast, if not faster, in non-fluoridated industrial countries as fluoridated ones. The exact cause of this phenomenon is not well known, except for the fact that dental hygiene and professional care have increased in industrialized countries and may also be attributed to the increased use of fluoridated dental products, like toothpaste. Despite clinical evidence that water fluoridation does not have the benefit to the teeth as once thought, it is still promoted in the United States by the government, dental and medical associations, and state health agencies. Often they state that fluoridation is the same as chlorination or is the same process as chlorination. In fact, it is not. Chlorination makes our drinking water safer by killing bacteria. Fluoridation, on the other hand, has nothing to do with water treatment. Its specific purpose is to use drinking water as the vehicle to deliver a chemical into the consumer's body for therapeutic benefit. In promotional literature by the American Dental Association, it's suggested that fluoride is an essential nutrient, giving the impression that fluoride is found in food sources like fruits and vegetables, and is essential, like other nutrients, for dental health. This simply is not the case. Clinical studies by the National Academy of Sciences and other governmental agencies have determined that fluoride is not an essential nutrient, and that test animals have perfectly good teeth in fluoride-deficient diets. If the government has determined that fluoride is not a nutrient, what is it? Although proponents assert that fluoride is not a medication, in December of 2000, the Food and Drug Administration stated to Congress, "Fluoride, when used in the diagnosis, cure, mitigation, treatment, or prevention of disease in man or animal." Let's take a moment to discuss the medical treatment in a doctor's office of a patient wishing to use fluoride to prevent dental decay. Clinical protocol requires the doctor examine the patient, establish the need for medication and clinical dosage, monitor the patient for adverse reactions, then set the dosage. Finally, and most importantly, the patient must give his or her permission for the doctor to provide treatment. This is known as informed consent. Medical professionals rely heavily on the physician's desk reference, or PDR, as the primary reference on substances like fluoride prescribed to patients for the care, mitigation, treatment, or prevention of disease. The PDR states that some people are hypersensitive to fluoride, demonstrating reactions which disappear once the fluoride treatment is discontinued. According to the PDR, other hypersensitive individuals may suffer from skin eruptions, such as atopic dermatitis, eczema, or urticaria. They may also experience stomach distress, headaches, and weakness. But what does this have to do with water fluoridation? It is a recognized medical fact that 32 ounces of water, fluoridated at the so-called optimal level of 1 part per million, contains 1 milligram of fluoride, the same as a 1 milligram fluoride tablet prescribed in the doctor's office. Unlike medical treatment with fluoride, how can you control the amount of water a person consumes each day? Some children drink none. Other people suffering from diabetes or who are physically active may drink more, much more than 4 8-ounce glasses of water each day. Simply put, it would seem natural to take a pill with a glass of water, but very unnatural for the glass of water to be, in and of itself, a pill. Most importantly, if a doctor is not permitted to administer fluoride to a patient without first obtaining informed consent, how can it be acceptable to administer a substance which treats an entire population without their informed? The American Dental Association has listed fluoride as naturally present in all water, and it is, much like other contaminants such as lead and radium. The chemicals used for water fluoridation are not the highly purified, pharmaceutical-grade products one would expect. Instead, they are waste products from the aluminum and phosphate fertilizer industry, which contain other high toxins like the heavy metals arsenic, lead, and chromium. The Environmental Protection Agency, under the Clean Air Act, requires industry to reduce toxic air pollutants, including fluoride, from their emissions. Chemical scrubbers are used to remove the airborne toxic fluoride from industrial smokestacks. This residue, hydrofluosilicic acid, is then pumped directly into rubber-lined tanker trucks and delivered to the water supply, untreated. While sodium fluoride is used in about 10% of the country for water fluoridation, 90% of fluoridated communities in the United States use the hydrofluosilicic acid removed from industrial smokestacks. In 1999 congressional subcommittee testimony concerning hydrofluosilicic acid, the EPA stated, "In collecting the data for the fact sheet, the EPA has not been able to identify chronic studies for these chemicals," meaning these chemicals have never been tested in health studies. In fact, even the American Medical Association confesses that water fluoridation may be harmful to some people because it has not done any research into the potential long-term or short-term side effects. International aid organizations have also recognized the lack of scientific studies to support exaggerated claims. These chemicals, delivered into the water supply, must be handled very carefully. In fact, direct exposure requires the use of a hazmat suit with full respirator. The hazardous properties of fluoride were recognized long ago. In this 1954 photograph, a water supply worker posed next to a sodium fluoride barrel, demonstrating the safety attire required even then. The proponents of fluoride suggest claims that fluoride is a poison are overstated, that you'd have to drink many gallons of fluoridated water in order to get sick. This is true when you're talking about acute fluoride poisoning. The fact is, fluoride, like lead, accumulates over a long time in the human body. It is argued that 1 part per million is like adding 1 drop of the fluoride chemicals into 1 gallon of water, making 1 part per million. According to some health officials, this can be compared to 1 inch in 16 miles. Now, this seems reasonable until we consider that the United States Environmental Protection Agency has established the maximum contaminant level, or MCL, of fluoride to be only 4 parts per million, or 4 inches in that 16-mile analogy, making the margin of safety from safe to unsafe fluoride levels only 3 parts per million, or 3 drops in that gallon of drinking water. It is well known that 1 glass of water, like 1 cigarette, is not harmful. Rather, just like cigarettes, it's the lifelong consumption of fluoridated water which raises health concerns. Proponents have always asserted fluoridation is absolutely safe. Yet every year in this country, fluoridating equipment has broken down, exposing thousands of people to dangerous fluoride overdoses simply by turning on the water faucet in their home. In October 2003, a Marlborough, Massachusetts fluoridating equipment failure created an overfeed of over 24 parts per million in the municipal water supply. This is 6 times the maximum contaminant level established by the Environmental Protection Agency, and 24 times greater than the optimal level. In response to this failure, fluoridation plant workers went door to door to warn residents not to allow water to come in contact with their skin in order to avoid irritations and burns. Just a few years earlier, similar equipment problems caused another fluoride spill in Wakefield, Massachusetts. Researchers who've studied the chemicals used for water fluoridation have expressed their own concerns regarding not just fluoride, but the lead and arsenic contained in this industrial waste product. Studies published in 1999 and 2000 by Roger D. Masters of Dartmouth College in cooperation with chemical engineer Miles J. Copeland reveal that studies of 280,000 children in Massachusetts and 151,000 children in New York show increased lead levels in the blood serum samples taken from those children drinking fluoridated water containing silica fluorides derived from the phosphate fertilizer industry. When the EPA was contacted regarding this study, they responded that the agency had conducted no health studies regarding drinking water additives. The U.S. Environmental Protection Agency plays a pivotal role ensuring the environmental health and safety of all Americans. The union, which represents EPA scientists in Washington, D.C., has requested a national moratorium on water fluoridation, stating that fluoridation amounts to mass medication of an unapproved drug whose dose cannot be controlled. These respected scientists show that foods and beverages have higher amounts of fluoride because the water used in their manufacture or preparation is boiled. Boiling fluoridated water increases the concentration because fluoride does not evaporate with the steam. The letter, authored by Dr. J. William Hersey, Vice President of the union which represents more than 1,500 EPA professionals, including scientists and lawyers, says, "In summary, we hold that fluoridation is an unreasonable risk. That is, the toxicity of fluoride is too great, and the purported benefits associated with it are small, if there are any at all. That requiring every man, woman, and child in America to ingest it borders on criminal behavior on the part of governments." The EPA recently removed its support and has actually been taken off the list of fluoride supporters. It is often stated by proponents of fluoridation that no credible person or organization speaks against fluoridation. We've already introduced you to some. Here's another. Dr. Hardy Limebeck, Bachelor of Science, Ph.D., Doctor of Dentistry and Associate Professor, Head of Preventive Dentistry at the University of Toronto, Ontario, Canada. Dr. Limebeck once supported fluoridation. Now, he officially opposes it. In April 2000, Dr. Limebeck expressed deep concern over industrial-grade chemicals being used for water fluoridation. Hydrofluosilicic acid, derived from the smokestacks of phosphate fertilizer companies, which have never been tested for safety in humans. Citing volumes of peer-reviewed scientific research, Limebeck demonstrates that fully half of all fluoride remains in the skeletal system and accumulates with age, and only a few years of consuming drinking water fluoridated at the recommended level of 1 part per million increases the risk for bone fracture. He also notes published studies which demonstrate a dramatic increase in dental fluorosis throughout North America. These studies point out that infants and toddlers are particularly susceptible. Some will even require extensive restorative dental work. According to the American Dental Association, 360 million people worldwide drink fluoridated water. After 60 years of promoting fluoridation, this represents only 5% of the world population, about equal to the population of the United States. Think about it. This means that 95% of the world has not implemented or has rejected water fluoridation. Some countries are beginning to reverse their fluoridation policies because of the scientific evidence and public scrutiny. Most countries state they do not put toxic chemicals in the water supply. Other countries, like Japan, consider fluoride use an individual choice. France indicates that fluoride chemicals are not included on the list of chemicals for drinking water treatment because of ethical as well as medical considerations. Nobel Prize winner for medicine, Dr. Arvid Carlsson, states that fluoridation will harm some people and is not considered a proper healthcare measure in his country of Norway. He further says that fluoridation of the water supplies would also treat the people who may not benefit from the treatment, that side effects cannot be excluded, and that some people might have only negative effects without any benefit. Carlsson says that in Norway there was a rather intense discussion on this subject for some 20 years. The conclusion was that drinking water should not be fluoridated. If dental decay is on the decline worldwide in both fluoridated and non-fluoridated countries, and in fluoridated and non-fluoridated cities across the United States, is there really an oral health care crisis? Yes, there is. Countless articles written on this subject have described the stories of people suffering from dental disease. Cities like Boston, fluoridated for more than 30 years, and states like Connecticut, almost 90% fluoridated for decades, report that cavity rates are increasing substantially. According to a New York State Department of Health study in Newburgh, ironically one of the first communities ever fluoridated over 50 years ago, many children have more cavities than in nearby Kingston, which has never fluoridated. Washington, D.C., fluoridated in 1952, has one of the highest dental decay rates in children anywhere in the country. This growing number of people suffering from dental decay demonstrates the oral health crisis to be more of a dental care and access to dental care crisis than any lack of fluoridated water. More and more cities across the country fluoridated for a number of years. A February 2000 report sponsored by the Special Legislative Commission on Oral Health for the state of Massachusetts indicates that one of the major factors contributing to the oral health crisis is access to dental care. In this report, the Division of Medical Assistance received over 4,000 calls a month from Mass Health members who could not find dental care. The report continued, saying 88% of the practicing dentists are not active providers in Mass Health. When interviewed, dentists complained of having to fill out too many forms, low reimbursement rates, and slow payments for their dental services. Now that it's been demonstrated, fluoridated water has diminished benefits and is potentially harmful because of equipment failure, increased dental fluorosis, and other serious health concerns. What can we, as a community, do to address the oral health crisis? Reducing the amount of highly processed sugars we consume is a good start. So is improving dental hygiene education in our schools, properly funding prevention programs, and sponsoring oral health education to provide services to the poor throughout our community. But we must also work to provide and support realistic funding to reimburse the dental professionals who provide the most important part of the solution: dental care. Like all drugs and chemicals, the benefits and risks of fluoride will be debated for many years to come. The major issue with fluoride is forcing everyone to consume this toxic chemical without individual consent. In closing, all of us believe that teeth are good things to have. But putting a toxic waste product in our water that changes our physiology without our consent violates one of our most important freedoms: our health freedom. With questions and health concerns about fluoride chemicals increasing daily, we should support the EPA union scientists in calling for a moratorium on water fluoridation. This program is just the beginning of the fluoride story. Visit the website of international researcher and lecturer Dr. Paul Connett at www.fluoridealert.org.